Boston has long been a pioneer in medical practices, and the story of Floating Hospital for Children shows pioneering in science of medicine, but also philanthropy. The hospital began as a boat in Boston Harbor, but the ripple effect spread widely in the practice of pediatric medicine. Founded in 1894, the hospital is affiliated with Tufts Medical Center. To tell us about the new book on floating hospitals' first century are two guests from the medical center: the director of adolescent medicine, Dr. John Kulig, and the director of volunteer services, Dan Bird. I'd like to thank you both very much for being with us.
Thank you very much.
Thank you for inviting us.
I want to start with Dan Bird. This is about a 100th anniversary that took place 20 years ago, so explain the gap.
Well, the 100th anniversary was celebrated in the book. A manuscript of the history was actually written, but through a variety of reasons it just didn't get published, and so that manuscript reappeared and came back, but the funding was made available, so we chose the 120th to actually make the presentation.
Dr. Kulig, talk about 1894, what things were like, especially as far as public health in Boston.
There was very little science in pediatrics at the time, and the mortality rates for children in Boston were strikingly high in the summer because of cholera infantum, which was diarrhea and dehydration related to contaminated milk, poor water supply, and poverty. And so the origins of the hospital were really based upon the needs of the poor, and the thought that if one brought children out into the harbor for fresh air, sunshine, and clean milk, that they would do much better.
Yeah, Bird, this sounds like a simple remedy here, but getting this to actually happen, explain how that came about.
Well, as John said, the idea, there wasn't many things they could do medically to help the children. Fresh air was, if not curative, at least it was relieve some of the symptoms of the illnesses that they have. And Reverend Toby, seeing some of the mothers walking up and down the harbor and on bridges getting the fresh air for the children, and he was one of the leaders in social work at the time in the city, he started a fund to, let's say, if we can get a boat and get the children out on the boat to get the fresh air, and maybe at that time be seen by doctors and nurses. So it's a very much a philanthropic endeavor of the whole city of Boston.
How receptive were people to this? I mean, because you might say, well, these are poor kids, it's not our problem, so you got to get the money from the people who are not.
Also at the time, the city of Boston had a lot of immigrants, a lot of poor people, but also had a really very wealthy community. You might say Beacon Hill, people who, and it was a very socially conscious time in America on a variety of issues. So they took upon this. Helping children seemed to be a very natural and worthwhile cause.
Dr. Kulig, talk about what happens once you get all of these children on a boat. You've got a whole new treatment venue, really.
So not only treatment, but science and investigation. Laboratories were established on the boat. There was an inpatient ward, there was an outpatient ward, and they allowed families to participate, which was a revolutionary concept at the time. Most hospitals excluded parents from visiting their children. On the floating hospital, they were encouraged to come on the ship, learn how to care for the children, how to sterilize milk bottles, how to prepare everything in a sanitary fashion. They also allowed one child to come under the age of 6 because they recognized the need for someone to care for the other children at home. And they participated in a kindergarten program on the upper level of the ship.
Now, did this also maybe lead to some other kinds of rethinking about, let's say, what's hygienically acceptable in a home or building where people live?
Absolutely, and home visits were part of this. So it wasn't just the trip out on the harbor, but the nurses would actually visit the home of the children and the families to ensure that the instructions were being carried out.
Going back to Dan Bird, you work with volunteers now, so how does this history affect what you do?
Well, I think it's a source of pride that being part of an organization that has the rich history that we have. And we have many volunteers that work with the children in the evenings and also the neonatal intensive care. So it has been a great source for me anyways to get people to want to be part of the floating. Floating is a great story that's still going on today. So I think people want to be associated with it.
Yeah. Dr. Kulig, this was maybe, if only a little accidentally, a first, or at least one of the earliest hospitals for children. Now, put this in context, because at the end of the 1800s, going to a hospital, it's not what we think of it, the way it is right now.
Precisely. Hospitals were for the, quote, worthy poor who deserved the charity in the opinion of the boards of directors. And in fact, they were not places that the well-to-do would go to. They were concerned about acquiring infection and disease. So if you were well-to-do, you had the doctor visit you at home. And so this was an entirely new concept.
And what about having a separate area for really focusing on the health needs of children?
Very new concept as well at the end of the 1800s, because pediatrics was considered an appendage of obstetrics. The doctor who delivered the baby sort of took care of the child. And pediatrics only came into its own in the late 1800s. So the concept of the floating involving families has really continued on right into the next century, so that in 1963, for example, we were the very first hospital to establish a family participation unit where the family was allowed to stay with the child overnight and participate in the care of the child with the nursing staff.
Dan, talk about the importance of family participation, because this seems to be a forerunner of things that we hear almost as a standard way, standard strategy these days.
And it really is something that was started at the floating, partly because they had to. You couldn't send 200 children out on a boat without the mothers. So we sort of, we had to have the mothers there. So we began to realize that the mothers were such a vital, important part of the communication with the child, that it became a part of the ship as long as it was out there. And so that tradition carried forward, and I think it was a huge part of, we call it taking care of the whole child rather than just the illness. We take care of the child and all the child's needs, which involves the family. A lot of it was communication, and that's.
Doctor, how big a difference did this make in the mortality rate?
Oh.
The mortality rate was still significant. There were as many as 40% of the infants died among the first trips. The first year, I think there were 6 trips out into the harbor. But over time, they developed the science to treat, to understand that limiting intake of fluids was not the best way to approach it, providing intravenous hydration, selecting milk and breast milk that was clean. So they were able to make progress and expanded the service. But there were still, even into the 1900s and the next decade, significant mortality rate.
Dan, what about the floating hospital of today? I'm sure this evolved in a few ways.
Well, it has, but it's really still true to its roots, though. I think that's one of the things we've stayed with it, is the whole child. It has stayed with the idea is that we're a research facility, we're a teaching facility associated with Tufts University School of Medicine. We are one of the premier medical institutions for pediatrics in the hospital. People from all over the country come to this hospital just to be here. So what started as a great idea has continued, and I think that's the source of pride that we have.
And Doctor, looking back at some of this historic material here, how did you feel about what you do?
Very proud. I think it's a very special institution, and we found information on the treatment of diseases back at that time, and they were revolutionary. There were some major advances that occurred on that hospital ship with its 200 patients. At one time, it was the largest pediatric hospital in the world.
Right, a milestone. Thank you both very much, Dr. John Kulig and Dan Bird.
Thank you very much for having us.
From Tufts Medical Center. We'll have more news in just a moment.